Wonderful. Well, we are recording, and my name is, welcome everybody to the Georgetown Chamber of Commerce's virtual power hour to discuss Georgetown's mask ordinance. My name is Jim Johnson. I'm the president and CEO with the Georgetown Chamber of Commerce and will serve as moderator for today's program. A couple quick housekeeping rules. All participants are muted, and we are also stopping video so that we can focus on our speakers today. So those options are turned off. Should you have a question, please use the chat feature. If you're not familiar with Zoom chat, I don't know where you've been for the last 90 days, but it's a great tool, and you just send a message directly to me, Jim Johnson. So hit that drop down, hit it to Jim, and I will moderate those questions at the end. Today's topic will cover the following today: background and data for the decision on the ordinance, an explanation of the ordinance and its requirements, enforcement by businesses and GPD's involvement, and how this is being communicated to ensure customers have a strong understanding before they come into your business. You see our speakers, but our speakers today include Mayor Dale Ross, City Manager David Morgan, Wayne Nero, Police Chief, City of Georgetown, Jack Daly, Community Services Director, City of Georgetown, and Ali Van Dyke, Director of Communications and Public Engagement, City of Georgetown. A little bit background for everybody on the call. On Monday, June 29th, Georgetown passed a mask ordinance that employees and customers at commercial businesses should begin wearing face masks immediately. Starting tomorrow, Friday, July 3rd, businesses in Georgetown will be required to adopt and enforce health plans that require face coverings for visitors and staff when physical distance cannot be maintained. The Chamber's mission is to facilitate economic success for our community through advocacy, education, and collaboration. And we hope today's conversation clears up any information and allows your business to be successful with this change. Though many businesses already have a policy, we believe that these are some necessary steps which will help protect our community, prevent another shutdown, and ensure our businesses can be successful moving forward. I welcome our first speaker today. I think at this point, I'm going to introduce Mayor Dale Ross for comments.
Hey, Jim, thanks for having us today. It's really important that we get a lot of information out to the good people of Georgetown, Texas. And I guess I don't want to talk about how I made this decision. But first of all, it had to be fact-based and it had to be data-driven. Every day, the city manager and Jack and myself, we get data from the health district, and it's really incredible data. It's very detailed, and it's specific not only to Williamson County, but also to the city of Georgetown. And we looked at it, and the data was getting alarmingly worse, so we had to do something. So when I was looking at this, I thought unity and collaboration was important. I think the more people you get on board, the easier it's going to be for people to comply with it, and also enforcement will be easier. So first of all, City Council was unanimous in wanting me to make this declaration. They've been very supportive through the entire process. City staff, which is primarily David Morgan and Jack Daly, obviously they were very data-driven decision makers as well, and they made the decision pretty easy for me just by presenting the data. Also, city staff, including the police department, we consulted with them and got their feedback on it doesn't do much good to have any rules if you can't enforce them. So we got their feedback and incorporated that. Also thought, because since this COVID-19 doesn't have any borders, it was important to get as many mayors on board in the region as I could. We had 5 that signed up. Originally, there were just 3. The first 3 were the 3 largest cities in Williamson County, which was Round Rock, Cedar Park, and Georgetown. And then Hutto and Leander came on board as well. And so I thought it was important that we all have similar orders, not exact orders. And that's what we ended up coming up with. And it actually, it worked out on a fairly fast track. Council last Tuesday wanted me to do something. So not this Tuesday, last 2 Tuesdays ago. And then the legal department had to draft the ordinance and make sure that it passed legal standards. And most importantly, I wanted to make sure it was fair to the businesses. And the feedback that I've got some of the business owners, they were glad that this order was issued so that everybody is playing on a level playing field. Everybody's playing under the same rules. Some of the businesses have already had the mask rule in place for their establishment. So now everybody in Georgetown will be playing under the same rule. The way this process has worked from the start of this pandemic, Governor Abbott would go and issue some orders. And then our county judge had an emergency declaration. His expired, and him and the commissioner's court chose not to issue any kind of regulations or requirements on masks. So then it fell to the cities. So we feel that leadership void. We went on and issued the orders, and I think that'll make our community safer. One of the things about this, unfortunately, at the national level, and that's filtered all the way down to the local level, is this mask is a political symbol. I don't look at it as a political symbol at all. I look at it as a symbol of respect and love and caring for our fellow Georgetownians, because it's not protecting the wearer of the mask, it's protecting the people that are around the person. And so I'm just hopeful. I've got all the confidence in the world that the good people of Georgetown are going to comply with this, because we just have a history of being a great community, and people love Georgetown, and they're going to do the right thing. Jim?
Thanks, Mayor, so much for those comments. And for those who are just joining us, we had a brief technical difficulties with some of the people once we hit a certain amount, but everybody should be able to get into the call now. So welcome to the Chamber's virtual Power Hour. Jack, thanks so much for being here today. Or actually, David, I'm gonna go to you next for comments. A little bit of background and to piggyback off what the mayor said. Next steps.
Yeah, so thank you for the chance for actually setting this up so quickly. I think it's a great opportunity to make sure that the questions that folks have are answered, and we want to try and help people comply as much as possible. I think the mayor did an excellent job kind of summarizing the thought process behind where we are today and the measures being put in place. And so we've got a process to be able to make sure that we answer your questions as they come up, because you probably will. And I think I just want to reiterate and stress the point that, we're working within the limitations allowed by the state, and also responding to just the increased number of hospitalizations that we're seeing occur in Williamson County, and using the measures that are available to us in order to help improve safety. And I can tell you that from an organization standpoint, we've also been working in our organization, because we know that one of the biggest threats is, in terms of the spread of COVID, is just the way in which we operate, not only with the public, but also within our organization, how we work. So we want to lead by example. We're working to make sure that not only do we comply with the mask order, but we also work towards what additional steps can we take just to keep our employees safe, as well as the public safe, so that we're able to provide critical services that everyone enjoys, as well as depends on. The last thing we want to have happen is for a electric lineman or a water service person who gets COVID, and that means that because we haven't put the safety precautions in place, that we're having half of our crew or all of our crew not able to provide the services, and then have threat to the critical infrastructure that we make sure that we maintain and everyone enjoys. So anyway, so it's something that is an evolving process that we're working through. We're taking it seriously, but also recognizing that that these kind of orders place challenges on businesses. So we want to do the best we can, again, working within the tools that we have available to us given by the governor. So look forward to answering questions, and Jack can go over in more detail the ordinance itself, the mask order, and then we'll talk about enforcement.
Thank you, David. Jack Daly.
Yeah, thanks, Jim. Just as some background here. So I know I personally feel it. I mean, COVID fatigue is setting in. I think people are burnt out and beat down, and this is this is a huge challenge, and I can't imagine. Businesses, not only are they dealing with the economic impact, but just the operational and logistics impact of COVID is pretty severe. And I want to recognize that and appreciate this huge group we have engaged in wanting to do the right thing. So, the governor announced phase 3 of reopening back at the beginning of June. and that's kind of when we started to begin to see an uptick in COVID's impact locally. So on June 16th, the governor did address some metrics that he's watching to kind of throttle the response to COVID across the state. And he's watching a couple things. He's watching hospital capacity, and then he's watching the positivity rate. And so probably a lot of people know this, but just in case, the positivity rate is we're doing all these COVID tests, and it's the number of tests out of 100 tests, what percent of those tests come back positive? And what the governor has said is if your positivity rate is about 7%, you're okay. If you hit 10%, it starts to get troublesome. And that's when we need to start thinking about what things can we do to limit the spread of COVID spreading throughout the community. Additionally, the governor has said, and this starts to get a little technical about, the relationship between local government and state government and who can do what. The governor has said, state or cities are not allowed to require individuals. We can't go out and fine an individual for not complying with a local mask mandate. But what cities are allowed to do, if they feel the need that COVID is posing a life to public safety and the health of the community, cities can impose requirements upon businesses to require businesses to ask their employees and customers to wear masks in situations where social distancing is not possible. So that's what Georgetown elected to do earlier this week. And just to give you guys a sense, I'm going to try, let's see if I can share my screen real quick.
Probably not, Jack, but give me 2 seconds. I'll let you do it, okay?
Okay, thanks, Jim. I just wanted to show the health district's website because I think it's a great resource.
I'm going to make you a co-host. Welcome to the fun part of it, and you should be, there you are, Jack.
You guys see this? So I'll share this link to Jim to share with this group. But this is the Williamson County and Cities Health District maintains some really outstanding data, and this is really what is driving a lot of our decision making here. So I just want to talk through a couple of these dashboards here. So this top line is just the number of tests that have been completed in Williamson County. So you can see, at the end of May, let's pull up May 30th, there's 8,000 tests completed. And as of June 30th, 17,000 tests completed. So tons more testing has been conducted over May. At that same period, if we look at May 31st, we had a positivity rate of 7.5%. So that means for every 100 tests that were done, 7.5 came back positive. At the end of June, that's jumped up to 13%. So you can see we've kind of jumped that threshold of, that 10% positivity rate. And that's when we need to start thinking, okay, even though testing is increasing, the percent of positive tests is also increasing. So we recognize that there's increased COVID-19 spread throughout our community. And then just one final data point that I think is really interesting is these numbers are the numbers of new infections of COVID-19 per 100,000 people. So at the end of May in Williamson County, we had 1.7 confirmed COVID-19 cases per 100,000 people, right? That's was new cases registered for that day. The health district tells us that we really want to say that we don't have community spread, that number needs to be under 1. So only, in a county of 600,000 people, you need to have, you should only be adding about 6 cases per day to be able to say, yeah, we really have COVID under control. As you can see, as of July 1st, that number's jumped to 17.7 new cases per 100,000 people per day. So these data points are kind of the impetus for, we don't have a vaccine. We, our hospitals are getting better at handling COVID, but the best tools, the best levers that the city government has available to them are encouraging people to stay home, encouraging people to, when they can't stay home, maintain social distancing, right? Because COVID spreads through the droplets. When I sneeze on you, I'm spreading droplets onto you. And if people can't social distance, then the best tool we have available to us to prevent the spread of COVID-19 is a mask. So our local mask order, it's posted online. So if you go to georgetown.org, and we can send, so I'll send the health district data set link and a link to the mask order. But in essence, boiling it down, it says businesses who interact with the public. So anybody who has customers coming into their facility, and customers could be, people buying things, people taking private lessons, people taking fitness classes. If you have people coming into your facility or your place of business, you need to set up a health policy that either ensures that at all times that customer is able to maintain good social distancing. So that means 6 feet away from anybody at any time. Or if they're not able to do that, then they need to wear masks. So you'll see a lot of retailers are already requiring people to wear masks as they enter the building. So you have this health policy, and the other requirement of the ordinance is that you post that health policy so people can see it. And so we have a sample health policy available in the ordinance, as well as some good graphics that you can post so people can visually understand. It's a lot easier than reading a local ordinance to visually understand what those requirements are. Our hope and our goal, and I know Chief Nero will speak to this, we do not want to be the mask police. We want to encourage people to be safe and do what we can to limit the spread of COVID-19, because I think we can do both, have our economy open in a modified way and be safe, right? So we're not going to get back to normal real fast if we just ramp up and our numbers keep trending in this negative, this poor direction. So if we can all kind of group together and work to keep each other safe, we'll help manage, remember people were talking about flattening the curve. We're trying to flatten that curve and limit the spread and the acceleration of spread. But at the same time, understand that we need to make sure people are able to do their business to the best of the ability. So I'll pause there and happy to answer any questions or turn it back over to Jim.
With Jack, Dale, I think this is the current data really gives us a snapshot of where we are in a deteriorating situation. I mean, based on the data from yesterday afternoon, there's 2,339 confirmed cases, and that's up 45% from a week ago, and it's expected to double again in the next 15 days. So the order says that we do away with the mask order once the positivity rate is less than 7%. It's at 35% as we speak. So we have a lot of work to do. And you look at, the ICU beds that are available in Georgetown. I mean, we have 255 active cases, and we can expect to need 13 ICU beds in the next 10 to 14 days, and we have 6. So it's a serious thing, and I really hope that all the businesses and all the people in Georgetown will treat this as serious and do their part so that we can get out of this pandemic. Jack?
Jack, you were turning it over to me. Thank you. What I would like to do for those who, as I said at the beginning, for our housekeeping that might have joined a little bit late due to some technical difficulties, but you're getting in now. If you want to send me a chat, we'll gladly go through those at the end of the day. I know some of y'all already are, and we're glad to get those questions asked to you. Jack, one quick question before we turn it over to the chief. You said businesses, and we've heard some from some nonprofits and place of worship, religious. So is there an exempt for nonprofits or places of worship in that? Maybe that's a first question before we go back over to the chief.
Yeah, there is an exemption for places of worship. However, there is a caveat to that. So if you're a place of worship that conducts business-like activities, like running a childcare or a daycare, or you have people coming in doing some kind of transaction, like if you're running a food pantry, would encourage you all to have a health safety policy in those situations where you have, I'll call them customers, coming in and interacting with your staff, especially in instances where they can't social distance. Would encourage you to have a health policy in place to encourage social distancing or ask that your customers and employees wear masks. Places of worship are generally exempt during worship service, but nonprofits that interact with the public are considered a commercial type business. You know, if you're bringing the public in, bringing customers in, and they're interacting with your employees, would really encourage you to have a health policy to make sure either you maintain that social distance or encourage your employees and customers to wear masks. You know, COVID is not selective as to, you know, what activity you're doing when you're doing it. So we're really encouraging people to encourage as much good hygiene and good health practices as we can.
Thanks, Jack, for that. Next up, we have Police Chief Wayne Nero. Thank you for joining us, Chief. And I know a lot of businesses are seeing this and seeing that they'll be fine and that, you know, the non-emergency number to call. So, you know, we love that you're here and you can kind of address some of those topics that businesses are having with that. And again, if you have questions, send them over to me and I'll get those after we get through the next couple stages. Thanks, Chief.
Hey, Jim, appreciate you having us. So, like, our number one goal, like, we always get the most popular component to this, which is enforcement, right? Speaking with the other area chiefs, which we've been in very close contact since all this began, and this isn't going to change much from when the initial stay-at-home orders were. Like, our goal is to really educate and inform what's required to gain willful compliance, not to issue citations. That's never been the goal. It's not going to be the goal now. The intent behind this is really to slow the spread of that down, as you heard from the mayor and David and Jack. And it's really what we're asking for is the businesses to enforce their own health and safety policy, not for the PD to have to come out and do that. So we're not going to be out in special patrols, roaming through businesses, looking for violations of orders. That is not, we have much more important things to be doing, but this is still an important topic. So kind of what you can expect is we're likely to get a bunch of calls. Like during the stay-home order, I think we averaged maybe 20 calls per week on average that we responded to, just from people calling in various violations, right? So I'll kind of give you a couple scenarios because we don't have all the answers. We're trying to work through this much like all of you are, to the best that we can, right? And there's so many nuances to what potentially can happen or who calls in what. So let me walk through a couple of those. So first is a low-level complaint. So let's say your business has you have to wear, like a restaurant, you have to wear a mask to come in, and then once you sit down because you're eating, that's an exception. You don't have to have a mask while you're eating, right? Then somebody gets up from a table and goes to the restroom and doesn't put a mask on, and somebody calls 911 to report that. I know that sounds crazy, but that's the world we live in, and there's people who are going to do that. If it is a complaint like that, we are likely not going to respond in person. What we're likely to do is we are having supervisors handle all of these calls like we did with the stay-at-home order. So the supervisor is likely to call the business, to speak with management, inform them of the complaint, what the nature of the complaint is. We're probably going to ask if you have a health and safety policy posted, what it says. We'll compare what it says to what the complaint is, because there's potential in a lot of those where somebody gets up and doesn't follow the rules, and staff or supervisors or management there doesn't even know it has occurred, right? So we'll get that on the radar of management, ask for the cooperation and making sure people that are there are complying with that. If management doesn't seem to understand the order and what's necessary, what's explained, we might go out at that point and just give a copy of it and have a moment to explain what's required and what they need to do, or answer any questions.
Chamber of Commerce, this is Allison. Can I help you?
And then we will have the supervisor document that call thoroughly for future reference, right? If a warning is appropriate, we might issue a warning, but we're not likely to issue a citation like in a case like that. Now, if you have a more serious call, let's say there's a very small business with a very small storefront or lobby, you know, a scenario we walk through is like a UPS store where you go to mail packages and there's only a small area, and say you have 10 people inside and there's no distancing and no one's wearing a mask, and you're the 11th person that walks in, and that person is like, oh my God, and they step out and they call PD to report a violation. You know, that business doesn't have, if there's no queuing set up, right? There's no tape on the floor. There's no measures that have been, you know, attempted to try to adhere to what the mask ordinance is asking for. You know, that might be a different story, right? So the supervisor is going to respond to those type of calls, and it'll be the same thing. We'll kind of inform management of what the complaint was. We'll investigate the complaint. We'll ask to see if they have a health and safety policy, which is supposed to be posted. We'll kind of seek to understand what the nature of the complaint is compared to what the health and safety policy requirements for that business is. We're going to ask for cooperation with management to enforce that. And just depending on how egregious that is, you know, our goal is just to issue a warning and make sure that the business is becoming the police for the rules that they have set in place, not that we're having to do it. So what I would say is only in the most egregious circumstances are we ever likely to issue a citation. That is definitely not our goal. If there is no health and safety policy posted, that's one of the big requirements of the ordinance, like that we're going to take particular interest in. So we want to make sure that happens. So it's really only when a business just doesn't want to do anything at all, and everybody on this call would be like, yeah, that's just crazy. I mean, there's like 50 people all standing around dancing, having a party, and nobody's got a mask on, and they're all within 1 feet of each other. Like, that would likely be a problem. But outside of that, the goal is just to get them to be compliant. And the last thing I would add is if you, as a business, are trying to enforce your own health and safety policy and a customer just doesn't want to comply and they are asked to leave and they don't want to leave and you call us for that reason, we will respond to that and that will be treated just like we would without the mask order. That's a criminal trespass issue. We will come and help you ask that person to leave and try to get their compliance to do so.
Chief, you know, you've addressed calling GPD, you know, non-emergency 911. Does it depend on the, you know, I mean, what is your recommendation, or is it based on the situation for that?
We're going to ask this great question. We're going to ask you to call the non-emergency number.
Okay.
If someone's on fire, and then you call the fire department. They'll come deal with that. No, that is not a 911 call.
Okay.
It's a non-emergency call. Right?
Okay.
To keep the 911 lines free for like true emergencies.
Appreciate that, Chief. You know, one question, Chief, that I had, and like I said, I'm going to go through these questions at the end, and I thought I'd start with you before we give Allie a time to speak. You know, somebody just asked, you know, and you deal with probably de-escalating situations daily. You know, if a business has somebody walk in and they are just adamant that it's their God-given right to not wear a mask, and they're becoming any way to any good comments or suggestions on quality customer service to de-escalate that situation?
You know, that's a $1 million question, right?
Sure.
Just treat people humanely. That's it.
Okay.
Right? If you have an unreasonable person and you're trying to be reasonable, that's about the best you can do, right? I mean,
Right.
de-escalation, there's no magic science to that. It's just seeing people as people, right? One of the issues with this is it's such a polarizing issue for some people, right? That they want to take a stance, and this is going to be the hill that they want to die on, right? Well, it is your God-given right to have an opinion. It's your God-given right to wear a mask, not wear a mask, but you're just not going to do it in that business if that's where they have a rule.
Yes, sir.
That's the bottom line. So if they don't want to leave, if you can't, you know, patiently convince them of that, and they don't want to leave, then you have no choice but to call us, and we can come help try to facilitate that.
Thank you. Thanks, Chief, for that. I
Down to
appreciate.
Yeah, it's just treating people. We respect those polarized positions, but you can take that position outside or to another business. It's just not going to be here. Right?
Understand. Thanks, Chief, for that. So one question, and Allie, maybe you can address this and you can say yes, you feel like you can, is a lot of, you keep mentioning the actual policy, the sample health and safety policy. And I know the city has the one-page flyer. Does that classify as a safe and health and safety policy, or is there something more specific that needs to be listed? And Allie, you can maybe unmute since it kind of dives into your area with communications, or let Chief, Jack, whoever wants to take that question before Allie talks. Jack raised his hand. Jack Daly wins. So Jack, go ahead.
Yeah, so we have in the ordinance, I think Allie's pasted the link to the ordinance. There's after the order, there is a sample health policy, and it's one page. It's really simple. So you post that. There's also some accompanying graphics. So, you know, our experience at the city is people don't read signs, but they may look at a nice, colorful picture. So we are trying to, you know, understand our audience and meet them where they're at. So the picture is there to help remind people, you know, if you can't maintain 6 feet of distance, you need to wear a mask. And that's really the basic, you know, the most basic health safety policy that we're asking businesses to adopt. I will say one thing, if your business is inclined to adopt a more stringent or different health safety policy, if you want to require people get a temperature check or, you know, sanitize their hands before they can come in, businesses are allowed to do that. We're just asking them to meet this minimum standard, but certainly businesses can elect to exceed the standard or do take a different approach, but we are asking them to at least meet the minimum of either set up your interactions with employees and customers where they can maintain 6 feet of distancing, and instances where they can't do that, ask that they wear a mask. You know, that's a minimum requirement, and the minimum one-page health safety policy gets to that's in the ordinance.
Thanks, Jack. Thanks for that answer. And again, people, those who are on the call, you know, this ordinance, we are trying to, the mayor, as he said, trying to keep our community open, keep your business being allowed to sell goods and have economic success. So, Jack, thanks for that answer. Last person in our panel before we turn over to questions is Allie Van Dyke. Started January 1st, I think, with the City of Georgetown, Director of Communications. And, you know, one of the questions that we got from businesses was going on is, you know, there are going to be circumstances where you are the first person to let somebody know about this ordinance. But how is the city getting this message out to the community so as your customers come in, they are already aware of the ordinance? And so I wanted to have Allie on this. And Allie, I'm going to ask you to unmute, and the floor is yours. Allie, thanks for being here. And welcome to Georgetown. I know it's been a couple months, but with COVID, not everybody's got the chance to meet you. So welcome, Allie, and thanks for all you're doing.
Yeah, thanks, Jim. Yeah, it's been an interesting first 6 months at a new job. I'll say that. So I'll be kind of brief. If you guys want me to go into more detail, I'm happy to. But starting as soon as we got the signed order on Monday, we sent out a news release with some clips of the mayor so that media could use it. And given, you know, our research on media, it definitely made the rounds. So hopefully people who get the news saw it there. But not everybody does, right? So we also are relying pretty heavily on social media. We did a couple of local alerts on Nextdoor and Facebook, which does an extra push to followers. And then we uploaded the mask website the same day. We did add the FAQ yesterday, so that's new. But that mask website, I linked to it in the chat. It should have all of the resources. I'm taking notes of your questions and our answers, and we'll update that FAQ again. So I think that'll be a really good resource for you. And we did a second social media push that afternoon once the mask website was up. I haven't checked again today, but yesterday it had reached over 180,000 people on those different ways. So people hopefully got the message.
That's almost triple the population. So, you know,
we tried. So we also are really trying to get the message out in both English and Spanish. So we have signs available in Spanish. We did a Facebook ad targeting Spanish speakers, so hopefully they're able to get it. And we use Google Translate on our website. So if anyone's having trouble understanding, you can select Spanish and it'll translate it there. We also emailed HOA neighborhood leaders, and Georgetown ISD is going to include information in their newsletter next week as well. So our next step, we're going to start promoting the answers to frequently asked questions on our social media sites. Obviously, with 180,000 reach, we got like 1 or 2 comments, and some of them were questions. So we tried to answer those on the FAQ. We're also going to be sending out more information today through Nextdoor and Georgetown Weekly, which is our e-newsletter. If you haven't subscribed to that, that's always a good resource. It comes out every week, and it's got a pretty good recap of what's gone on. The reach there is about 40,000 combined, so fingers crossed. And next week, we're probably going to send out an email and text message to all of our utility customers, and that reaches about 45,000. Wow. So you guys, I'm absolutely open to any other ideas or avenues. If you have them, we're totally willing to do that. If you do if you do get questions, go to that FAQ page, and if it's not there, you can direct people to pio@georgetown.org, and we will do our best to respond as soon as possible.
Wonderful. Allie, I think y'all are doing a great job, and short of walking and knocking on everybody's door, that would probably be the way that you're communicating. So thank you to what the communications department's doing there. If I volunteered one person to knock on every door, it'd be David Morgan. So David, I know we'd sign you up for that. So I've been moderating questions and trying to fill in place this. And so that's the perfect segue. I'd say I planned it. one of the businesses does a lot of door-to-door sales, and that's where a lot of their business to business is. So can we walk through, is that allowed to do, to go through the city and get a solicitation permit and go knock on resident stores, and is there any restrictions with that, with business to business and going and cold calling on a business? So first question out the door, raise your hand if you're not, or you can just unmute yourself and answer that question. Or nobody hasn't, one of y'all has to. Jack's got it. Go.
Chief, solicitors, right? That's something we've talked about a lot. So originally when COVID first started, we had some concerns about solicitors permits and allowing people to go door to door. We are permitting people, and Chief weigh in where I get it wrong. We are permitting, solicitors are asked to go to the police department to get a permit to be able to go door to door, and would encourage you to adopt a health policy for that activity. So when you're knocking on somebody's door, right, you're interacting with a customer, you're not able to guarantee 6 feet of distance. So would encourage you to wear a mask as you're doing that. And we'll look for that when we look at those solicitors permits.
Okay. Random question on that mask. And I think this is a kind of an overview question. What classifies as a mask? Like, is it just a face covering? Some people are saying shirts over them. What is classified as a mask?
Here we go. Face coverings for the general public. So all people over 10 years of age, this is in our mask order,
right,
shall wear a face covering. So a face covering means it covers your nose and your mouth in areas where it's hard to maintain social distancing. So that includes homemade masks, scarves, bandanas, handkerchiefs, but anything that can cover your nose and your mouth in those areas. And David's modeling.
I'm gonna spotlight him real fast.
That's a very nice feature there. Wow. So the requirements are spelled out in the ordinance, and there, another procedure mask, very nice. But anything that covers your nose and your mouth is considered a face covering.
Wonderful. Okay. So sounds like the covering up, somebody pulling their shirt over probably isn't what we're looking for. Something that's separate from that is what I'm gathering from that. Speaking of mask, couple questions on medical exemptions for masks. You know, I've seen on social media, people have been potentially buying cards that say that they're exempt, you know, and I think the ordinance, Jack, might have addressed certain restrictions with that, with health. Do you want to touch base on that?
Yeah, so the ordinance does have, it's got 6 exemptions here. So, so the first exemption is, you know, if you're outside engaging in physical activity outside, right, you're maintaining your social distance, you don't need to wear a mask. If you're driving alone in your car or with people in your household, you don't need to wear a mask. There's another exemption. So if wearing a mask poses a greater mental health or physical health or safety risk to the individual than not wearing a mask, right? A risk greater than COVID or the risk of COVID, then you're exempt from that, right? So hoping people will have some discretion and understand, you know, yes, it's hot and it's annoying to wear a mask, but there are people out there absolutely who wearing a mask is not appropriate and is not good for them. So we'll be respectful of that. The last 3 exemptions, you know, if you're out pumping gas or operating outdoor equipment, you don't need to wear your mask. If you're in a building or doing an activity where there's security screening, right? So we don't have a terminal checkpoint, but if there's an area where, you know, people need to do some screening, need to see your face, you don't need to wear a mask. And then, of course, the final one is, you know, if you're eating or drinking in a restaurant, you don't need to wear a mask.
Thanks, Jack. Appreciate those clarifications on that. Question that came up, and so since you mentioned outdoor activities, poolside, you know, if they're outdoor in a splash pad or near a pool, I'm assuming if they're in the water, no mask. If they're outside the water, social distancing, no mask. Am I interpreting that correct, Jack? Or do you want to add on that?
Yeah. So, I mean, I don't think we can say it enough. In situations where you're able to maintain 6 feet of distance, especially if you're outside, no mask, right? You're good. Now, if there's instances where you are forced to interact or you're getting close to people, inside or outside in a business, would encourage you to require masks in those instances. So I hope that answers that question. I mean, that is like the base level guidance that I think can be easily applied. Like if I'm within 6 feet of somebody, put on the mask. If I'm able to stay 6 feet away, especially if I'm outside, no mask needed.
Okay. I think you're simplifying that. Again, if you have questions, you can send them privately to the chat. A couple more that we're going through. Jack, again, on the signage that we talked about, is the one-page beautiful sign that you have that's available for free pop-up pickup at Minuteman Press, and I know some other printers have those signs. Is there is that enough, or do they need to have a more thorough understanding of that, or is that signage enough for postage requirements? That one colored sign.
I think businesses like you're required to post your CO or other things that you're required to post, that technical policy, that one page is required to be posted somewhere. But at the front of your door at the entrance, the pop on a mask signage is more than appropriate to help alert your employees and your customers to those rules. But we are asking that the policy, the technical policy, that one pager that you can steal from the ordinance, or if you want to adopt your own, be posted somewhere in your business.
Okay, so that's a good clarification, and that that's the official guidance on that end, so that we know what's going on. And somebody had asked if they had a sign that said, "Please wear a mask, please social distance, keep 6 feet." Is that a clear enough policy? Doesn't sound like it. Sounds like it does need to say mask required, because it is required, not just a please wear a mask. Am I answering their question appropriately?
Yes. So if a business, and sorry, I mean, I hate to just sound like a broken record. Yeah. If a mask is required, if a business is not able to ensure that all times their customers and employees are not able to maintain 6 feet of social distancing, right?
Okay.
So if you can do everything from a distance, you're good. But if you're not able to do that, then yes, masks are required. And I think Chief Nero was raising his hand.
Ask to unmute. There you go, Chief.
Yeah, I just want to make sure, like, what we'll be looking for is that sample policy. Like, if you want to have signage that, like, the example is the signage points to provisions of that policy, like, that's a separate issue, right?
Okay.
We would be looking for the actual policy of what you're requiring internally. That's what we want.
Okay. So you want it, there needs to be signage on the door to let people know, but really that is almost not a requirement. It's the policy to say that you're doing it is what you need to have available for businesses. And I think what we can do for those on the call that are going to say, what is that? I don't want to go hunt it down. I think we can definitely work with Allie in the communications department to get that policy, and we'll email that out to everybody that's on this recording. Couple specific questions. If let's say you're in a bowling alley, and that's a really specific example, you're on the lanes, is it required? I feel like you're going to sound like a broken record, Jack, but if they're bowling in the lanes, they're near 6 feet, it sounds like they're going to need a mask. Am I correct on that, Jack?
Yeah, I would say my hunch is, I haven't been to a bowling alley to measure, but my hunch is that if you're bowling, especially if you're bowling with a team and you're sitting together, it's going to be difficult to maintain that social distancing. So would encourage the policy to have masks on in a situation like that.
Okay. A couple questions specifically regarding childcare, but I think those questions were answered in the group chat by Ali regarding childcare. But Ali, just for those who were lost in the chat feature, did you want to kind of comment briefly on daycares? And I think some of the questions were, from 4 weeks to 12, and mask requirements. Can you go on that kind of type on that end?
Yeah, so it's on the FAQ page. I've linked that too, and we'll definitely make sure to pull out that policy. So it's a quick click and download. So on that. So the answer is that teachers, counselors, and staff at child care centers must wear face coverings if they are not able to keep 6 feet of separation from one another or from the children. Children who are at least 10 years of age must wear face coverings if they cannot keep 6 feet of distance between themselves and other individuals. The face covering requirement does not apply when children are engaged in outside exercise or outdoor physical activities, especially when they're in bodies of water or engaged in any type of water play, such as a small pool or a splash pad.
Thanks, Allie. For those, we have a couple people in childcare. Let's talk about a commercial office that has very few visitors. What I am interpreting the rule, and Jack, the question basically is, if they have limited visitors to the office, they're inside their own office at all times. Talk a little bit about mask. I feel like I know the answer, but that's the question. They're in an office, they're by themselves. Let's say they have to walk down the hall, pass another employee. Let's talk a little bit about that and that interaction on that end.
Yeah, I can tell you the guidance we're giving to city employees. So we have a lot of employees in offices here. So the guidance for city employees, which I think is appropriate for others to consider. When an employee is sitting at their workstation or in their office, doing their business, they don't need to have a mask on. But anytime they get up, walk to the hallway, walk to the break room, walk to the restroom, you start to lose control of your ability to avoid or maintain that 6 feet of distance if somebody passes you. So we're asking, as employees are moving throughout the building, just pop on a mask. When you get back to your workstation, you can take your mask off. But that's kind of the guidance that we've adopted as a city, and I think would be recommended for other like employers who have a lot of people just in their office doing their job.
Okay. Quick question. Plexiglass, I'm probably using the wrong term. Does that exempt the 6 feet, or does that require, you think about those glass things that come up. Does that exempt any of the 6 foot rule or the mask rule, or?
I think so. If anybody else's experience is like ours, we bought a lot of plexiglass over the last few months, and we have it, our public lobbies are blocking people. And we have the markings on the floor, and even with plexiglass and markings on the floor, when people are interacting, having kind of a customer interaction, they're really bad about staying behind the plexiglass. They kind of lean around, or it's natural for people to try to get that close connection. So I think plexiglass is a great tool to help block droplets, but I really think, if you can't guarantee that people are going to stay 6 feet away, would encourage people to wear masks, especially in those instances where you're having really close contact with people.
Okay. So speaking of close contact, a couple different people are on the call in workout facilities, gyms. There's talk about the mask and what you talk about physical activity outside, but I can't say I go to the gym enough. I'll just be honest with the group. I know a couple people on this call are active. So Jack, do you want to talk about gyms and how that plays a part in this with the mask requirements while doing your bench press and whatever else you do at a gym? I stopped there. So go ahead, Jack.
Yeah. So I will say, after I stop speaking here, the governor has issued some good guidance on gyms and exercise facilities. So the governor, I'll post a link to kind of this Open Texas website, and there's some good guidance there. I know I'm a broken record. So in a gym, right, anytime, when the customer comes in and they're interacting with somebody and they're within 6 feet, they need to put on a mask. If you can set it up where your exercise equipment is spread out and people are able to maintain that social distance, and I know gyms are taking all kinds of other unique precautions, but if you can set it up where, they're not bumping into people, I think a similar health safety policy is, as a customer is moving throughout the facility, maybe they have a mask on, and when they get on that equipment, as long as that equipment is maintaining a distance of 6 feet or greater from any other customer, any other employee, okay to take the mask off. But gyms are unique. Let me pull up the governor's guidance here so you can see what other recommendations the state has for exercise facilities.
Jack, I think most of the gyms have probably already seen that.
Okay.
So I would say for now, don't worry about that. If any of the Chims have more questions, we can get them out. But I imagine by now they've seen the governor's order, more just specifically to the mask ordinance and how that was
Yeah.
going to play a factor
Yeah.
in that. I'm actually not seeing any more questions. Let me check my notes to make sure I've covered everything on our end. No, and I think the one question we had at the very beginning was about the health district data. And Jack, that was before you shared that wonderful information. And I know we'll get that link out to everybody on this call. I want to thank Mayor Ross, Chief Nero, City Manager David Morgan, Jack Daly, and Ali Van Dyke for being on this call. We had over 135, actually 150 people participate in the call with less than 24 hours notice. So that shows that we are trying to get information out to you guys in a timely manner so your businesses can continue to be economically successful. Again, Jim Johnson, President and CEO with the Chamber, we thank you for all you're doing. Shop Georgetown. You have plenty of choices out there. Let's continue to support our businesses in Georgetown. The Chamber is here for your needs. Should you have any questions or concerns, please email us or call us. You know my email. You've gotten an email from me, so just reach out at any time. We thank you for what you're doing. Have a safe and wonderful and hopefully a little relaxing 4th of July. Again, thank you to our friends. Mayor, love the poppy mask. Mine's in the one that your wonderful wife made for me is in my truck still. It's my go-to at times. Thank you guys. This was recorded, so we will share it out to everybody. Have a wonderful, safe 4th. Thank you for all being here today. God bless. And I'll end.